Living with a lung disease means that even an ordinary day can leave you struggling to breathe. This leads to patients asking themselves questions like, will I get an appointment in time? Will someone actually check in on me? And will I be able to pay for my care? But you are not alone. Across Europe, more than 80 million people live with chronic respiratory diseases. We often face the same barriers: late diagnosis, weak follow-up, and unequal access to tests and treatment. The World Health Organization has addressed this in a resolution on an integrated lung health approach, which sets targets for countries and is a formal commitment governments have signed and a tool to advocate for lung health. It means you can ask your government clear questions. Where is the plan? Where is the budget, and how will it be delivered? To take action, you can start by understanding what your country committed to. Integrate lung health into primary care. Prevent smoking and vaping by strengthening regulation and help smokers to quit. Ensure healthy air and vaccination for respiratory infection. Secure access to equipment to diagnose lung disease and needed and affordable medicines. Support the health workforce and ways to refer to specialist care. Invest in data, surveillance, and early detection. Reduce inequalities, especially for vulnerable people. Next, check how your country is doing. Are lung tests available? Are medicines reimbursed? Are prevention programs actually reaching communities? Then take the resolution into your advocacy and communications. Quote it in letters, reports, and meetings. Use its wording in press releases and awareness days. Bring it on paper or on screen and ask one clear question. How is our country delivering on what it already signed? Tell your personal story, where things went right or wrong for you, or for patients you know. Ask others to support you. Build alliances for lung health. Engage with patient organizations, respiratory societies, public health and environmental groups. When you speak together, the message reaches decision makers faster. Patients, carers and patient organizations hold the key in your country or community to improve the quality of life of people living with chronic respiratory diseases through patient experience, advocacy, partnership, and making governments accountable. The European Lung Health Group is a coalition of lung patient and doctors' organizations at European level, brings together priorities from different countries and voices them in European health policy discussions, giving patient voices a stronger, shared presence. The WHO resolution on lung health is a starting point and a great achievement. Let's work together for lung disease prevention and care, for better quality of life, and for every person in Europe to keep breathing.